Welcome to today's lecture on Wilms tumor, a pediatric renal malignancy. In this comprehensive script, we will delve into various aspects of Wilms tumor, including its epidemiology, pathogenesis, clinical presentation, diagnostic workup, treatment options, and long-term follow-up. We will also explore the significance of different histological subtypes, staging systems, and biomarkers in predicting prognosis and guiding treatment decisions. So, let's begin our educational journey into the world of Wilms tumor. Wilms tumor is the most common kidney cancer in children, with a prevalence of 1 in 10,000. It is more common in females and has associations with genetic syndromes and risk factors such as low birth weight, premature birth, and exposure to certain substances during pregnancy. Wilms tumor arises from the transformation of immature kidney cells during fetal development. The exact molecular mechanisms underlying this transformation are not fully understood, but several genetic abnormalities have been implicated. Mutations in the WT1 gene, located on chromosome 11, are found in approximately 10 to 15% of sporadic cases and up to 30% of familial cases. Other genetic alterations involving the WTX, CTNNB1, and TP53 genes have also been identified. Wilms tumor exhibits a wide range of histological subtypes, with the most common being favorable histology and anaplastic histology. Favorable histology is further classified into subtypes such as epithelial and stromal predominant, whereas anaplastic histology is associated with a worse prognosis. The International Society of Pediatric Oncology, SIOP, and the National Wilms Tumor Study Group, NWTS, have developed classification systems that help in the stratification of patients for appropriate treatment and prognostic evaluation. The clinical presentation of Wilms tumor varies, but the most common symptoms include a painless abdominal mass, abdominal pain, and hematuria. Physical examination may reveal a firm, non-tender abdominal mass that is usually unilateral. Diagnosis is confirmed through imaging studies such as ultrasound, which is often the initial modality used. Computed tomography, CT, scan and magnetic resonance imaging, MRI, provide further details on tumor extent and staging. In addition to ultrasound, CT scan and MRI are essential imaging techniques used in the evaluation and staging of Wilms tumor. CT scan provides detailed information about the tumor size, local invasion, lymph node involvement, and distant metastasis. MRI is particularly useful for assessing vascular involvement and differentiating the tumor from other renal masses. These imaging modalities help in determining the extent of disease and guide treatment decisions. Staging systems play a crucial role in determining the prognosis and appropriate management of Wilms tumor. The most commonly used staging system is the NWTS staging system, which classifies tumors into 5 stages based on tumor size, local invasion, lymph node involvement, and distant metastasis. Other prognostic factors such as age at diagnosis, tumor histology, and molecular markers also influence the overall prognosis and treatment outcomes. The treatment of Wilms tumor typically involves a multimodal approach, comprising surgery, chemotherapy, and radiotherapy. Surgery, in the form of nephrectomy, is the primary treatment modality and aims to remove the tumor along with an adequate margin of healthy tissue. Chemotherapy is administered both before and after surgery to shrink the tumor, prevent metastasis, and eradicate any residual disease. Radiotherapy may be utilized in certain cases to target specific sites of disease involvement. Surgical management of Wilms tumor requires a meticulous approach to ensure complete tumor resection while preserving renal function. Various surgical techniques, such as open radical nephrectomy, laparoscopic nephrectomy, and partial nephrectomy, can be employed depending on tumor size, location, and extent of disease. Potential complications of surgery include bleeding, infection, and injury to surrounding structures. Chemotherapy plays a critical role in the treatment of Wilms tumor and follows a specific protocol based on risk stratification. The 2 most commonly used chemotherapy regimens are the PSYOP and NWTS protocols, which differ in drug selection, dose intensity, and duration of treatment. Adjuvant therapies, such as immunotherapy and targeted therapy, are being explored to further improve treatment outcomes in high-risk or relapsed cases. Radiotherapy is reserved for specific indications in the management of Wilms tumor. It is primarily used in cases with gross residual disease after surgery or in the presence of certain unfavorable histological subtypes. Radiotherapy techniques include external beam radiation therapy and BRA therapy, delivering precise radiation doses to the tumor site. Potential side effects of radiotherapy include short-term skin reactions and long-term risks of secondary malignancies. Surveillance for recurrence and long-term follow-up care are crucial in ensuring optimal outcomes for patients with Wilms tumor. Regular imaging studies, such as ultrasound and chest X-rays, are performed to detect any signs of recurrence. Long-term follow-up involves monitoring renal function, blood pressure, and potential late effects of treatment, including cardiac toxicity and secondary malignancies. Biological markers and prognostic indicators play a significant role in predicting the outcome and guiding treatment decisions in Wilms tumor. These markers include genetic abnormalities, such as WT1 mutations, CTNNB1 mutations, and loss of heterozygosity, LOH, as well as molecular signatures, such as MYC amplification and IGF-2 overexpression. Identification of these markers helps in risk stratification and tailoring treatment approaches accordingly. In conclusion, Wilms tumor is a complex kidney cancer in children. Understanding its causes, diagnosis, and treatment can help medical professionals improve outcomes. Ongoing research is exploring new treatments and ways to identify high-risk patients. Thank you for watching, and I hope you learned something new.